Stop smoking before surgery. That's a decision that many people are faced with. Now, let me just state right from the beginning, I am not a medical professional. I am not giving medical advice. I'm not telling somebody what they should or should not do. I'm simply looking at a topic that a lot of people talk about or have concerns about and simply discussing my opinions about that. Now, as I've said many times in my videos, it's been 15 years, knock on wood, since I stopped smoking. I did end up in the interim during that 15 years twice with non-related things where I ended up having to spend at least some overnights in a hospital. And I know when I was a cigarette smoker, I was very concerned all those years, just saying, "Oh, how would I handle it? God forbid if I ended up in a hospital where you cannot smoke. Certainly most, I don't have any hospitals these days that would allow that with the oxygen, all the other things, and patient health and all, that where you could not smoke a cigarette, and then having to just stop cold turkey. Cold turkey is not, in my opinion, the way people would best suit themselves to stop smoking. I think when you want to stop smoking, I think you should start with a plan. I think you need to give yourself the time. Now, for those that can simply stop and never pick up another cigarette again, if you have that kind of iron willpower, go for it. More power to you. Any way you can stop that works for you, do that. But for most people, I don't think that's probably the best way to go. I do think that if you are able to plan a surgery, as many are these days, people have cosmetic surgery, they have elective surgeries, they may have surgery something that's not a critical, an ailment, a illness, something that doesn't require somebody to go impromptu in the hospital to be taken care of. If you have the time to prepare for something, and you are a cigarette smoker, then you do have some time to prepare to quit smoking, which will greatly serve you once you're actually having surgery, I'm sure. And again, not medical advice. I would assume, from what I would hear and read and things like that, that a non-smoker is going to probably be better for to have anesthesia. Okay, we got that out. To have anesthesia, I think that it's probably best for a person to be a non-smoker. It would stand to reason you probably breathe easier, and everything would probably work. I'm sure if you talk to an anesthesiologist, there may be more concerns when they're dealing with somebody that is a cigarette smoker as opposed to one that is not. I'm sure that a person that smokes, their health overall may not be the same as a non-smoker's health, although that's, again, I have no way of knowing that. I would have to assume that it would be logical that the recovery after surgery would probably be better, and certainly from a mental or emotional standpoint for the patient recovering, if every waking moment they're not just thinking about having a cigarette, it will allow them to better focus on them getting better and getting back out and living a normal life again. So, I guess to cut to the quick, if you want to stop smoking before surgery, the best thing I think to do is to begin with a plan, give yourself the proper amount of time to prepare ahead of time, you pick your date, and then you go forward once you have a plan in place and you follow the process. That it is always best, again in my opinion, to find a mentor, somebody that has done what you are looking to do and done it successfully in the past. I use the example, if you want to learn to paint pictures, find an artist that is successful in teaching other people how to paint, and then you will probably get better success in a minimal amount of time. The same would be true when it comes to stopping smoking. If you want to find out what I did 15 years ago to stop smoking, then I ask to click one of the links around this video. If you like this information, please like it, please subscribe, and I look forward to seeing you as an ex-smoker.